be discussing chronic kidney disease. Before we do any discussion, let's just look at the table of contents. So we'll first start off by looking at the definition, and the next couple slides go into the different stages of chronic kidney disease, how to diagnose it, causes of chronic kidney disease, some symptoms patients may feel, treatments for this disease, how to prevent it, a little review of what we learned in my presentation, some questions to see how much information you retained, and then last but not least, a reference list. So let's get started. What is chronic kidney disease? Basically, what it is permanent, lasting damage to one's kidneys over a period of time. When this happens, this means that your kidneys are no longer able to do daily functions to keep your body running normally. So this can mean that they are no longer filtering waste and toxins out of the body, of your blood, and keeping everything filtered and clean. There are 5 different stages of CKD, starting at 1, which is the most mild, and 5 being the most severe, where ultimately kidney failure occurs. Most doctors measure how well your kidneys are doing and how well they are functioning by something called the estimated glomerular filtration rate, also known as EGFR. So with this, when you have a high number, that means your kidneys are working very good and in normal shape, and the lower the number, the worse shape your kidneys are in. And this number will give an estimation of what stage CKD the patient is in. We're going to go into more detail in the next couple of slides. Another fact that I thought was interesting by the CDC that they posted in their 2019 report is that most adults with chronic kidney disease do not even know they have it. And I think these are rather high numbers, and this is kind of alarming and concerning at the same time, because these are high numbers and people do not even know that they have it. And when left untreated, it can be very severe and can lead to very fatal outcomes. So it's definitely important for people to be aware of chronic kidney disease and be on top of, annual checkups and things like that to make sure they are properly maintaining and functioning with their kidneys. So let's go into different stages. The different stages of CKD are separated by the number of EGFR. So in stage 1, this is where most of us are. It's where your kidneys are still in great shape and they're functioning normally, but there is a notice of some kind of kidney damage, whether literal, it can be very small, something you wouldn't even notice normally with no symptoms almost. So this is usually because of a pre-existing disease such as diabetes, hypertension, heart disease, where your body is already compromised by another disease and focusing on something else, so it's easier for kidney damage to occur. It's very important to stay on top of your diet and exercise and focusing on your body and not forgetting about other parts so that they don't, have further severe outcomes. So stage 2 is between 60 to 89 EGFR. So here the kidneys are still functioning normally, but there are further signs of kidney damage, and they start to appear more and more. This can include finding proteins in one's urine sample when going to get an annual physical, which means your kidneys are not filtering out proteins properly, or any physical signs of damage that can be seen on kidneys when you get an ultrasound. I just included a little chart here from stage 1 to stage 5 and how rapid the damage can be. So in stage 1, you have over 90% of, kidney functioning and it's normal and working properly. Meanwhile, in stage 5, you need kidney transplants and things like that because your kidneys are failing you. So the next stage is stage 3. Stage 3 is separated into 2 groups, 3A and 3B. 3A is between 45 to 59 EGFR, while 3B is 30 to 44 EGFR. During these stages, many patients do not report any kinds of symptoms, but those that do report symptoms say that swelling of the feet and back pain and not using the restroom often or urinating is very big in stage 3. So it's super important in stage 3 to either maintain your position or try to prevent any further damage, because when you leave stage 3 and go into the later stages, stage 4 and 5, by then you will need more severe action in order to, save your kidneys or, make sure that you are improving your quality of life and living without any pain. And also, it's important because chronic kidney disease can lead to other diseases such as anemia, bone disease, and high blood pressure if you don't already have it. And then I included a little diagram, a comparison of a normal kidney to a kidney that has chronic kidney disease. And as you can tell, the one with CKD is smaller, it looks a little shriveled, and it has a very textured, like shrunken texture on its surface, on the outer surface, and there's a more contrast in the color, so it's much more red and dark in certain areas, and it's almost a little yellow, showing that it is, more damaged, diseased, and that the functions of the kidney are no longer properly working. And then we reach stages 4 and 5, which are the most severe. And at this point, you need to look at different treatments and options for your kidneys, such as dialysis and kidney transplants. So stage 4 is where your kidney damage is most apparent, and the last stage before total kidney failure. You'll see various different symptoms, such as severe back pain, muscle and cramp pain near your kidneys, constant UTIs, and things like that. So basically in this stage, when people have stage 4 chronic kidney disease, they need to start looking at other options of treatment because eventually and inevitably their kidneys will fail. And in stage 5, we're less than 15 eGFR. This stage means that the kidneys of the patient have officially failed, and they must look at options to immediately replace their kidney so that kidney functions can continue because it is a vital organ. So symptoms of stage 5 include extreme pain all over the body, especially near your kidneys, muscle cramps, vomiting, diarrhea, and more. So when you're experiencing these symptoms, immediately seek medical care because you are, enduring a lot of pain and you need to replace your kidneys immediately. Here I included a chart of how common kidney failure is in certain pre-existing diseases, such as diabetes, which rates the highest, it has 38%, and then the next leading disease is high blood pressure. So it's very important when you have these two to look at your routine and your diet and make sure that you are maintaining a healthy lifestyle so that you do not get chronic kidney disease or further the damage to your kidneys anymore. So how does one get diagnosed for chronic kidney disease? Well, you can get diagnosed many different ways. The most two simplest ways are blood test and a urine test. So basically, when you go to your doctor, primary doctor, and get an annual checkup, they will check your blood and urine to see if your kidneys are properly filtering out any toxins or wastes. So in the blood test, they will check for, any waste found in your blood and make sure that your kidneys are functioning properly because any waste should be properly disposed by your kidney. As well as for your urine test, they will check for any protein or blood in the urine sample because if there are any found, this means your kidneys are not properly filtering it out. And then the next diagnosis one can look at is through the kidney scans. This includes CAT scans and ultrasound. Doctors will look for noticeable kidney damage on the outside surface of the kidneys, as well as any blockages in the urine flow or in the urinary tract, because that's all correlated. And then last but not least is glomerular filtration rate, which we mentioned earlier. What this test does is it checks the rate of which toxins are filtered out through your body and through the your blood and urine, which checks how healthy your kidneys are, because a fast rate means that your kidneys are working properly and they are in healthy shape. So, what are the causes of chronic kidney disease? Many causes of chronic kidney disease are things such as an unhealthy diet that may include high sugar or high salt intake, people who have constant substance abuse of things such as alcohol or tobacco, and it's super important because those with pre-existing illnesses such as diabetes, hypertension, heart disease, and with kidney disease running in the family, they are at higher risk. So it's super important for them to be watching their weight, watching what they eat and consume so that they do not increase their risk any more than it already is. And by a study that I read about, it said that up to 2/3 of the cases are caused by diabetes and high blood pressure. So it's super important that people with these conditions must regularly check their kidneys, maybe even more than people would normally check, because it's super important that they do not further damage their kidneys with these diseases. And I included a little photo of different things that can cause chronic kidney disease. As you can see, old age, tobacco use, family history, obesity, heart problems or stroke, high blood pressure, and diabetes. Some beginning symptoms of chronic kidney disease may include itching, swelling around the feet or ankles, muscle cramps, trouble breathing or catching your breath, nausea, loss of appetite, constant urinary tract infections, and things like that. The thing about chronic kidney disease is that it's very hard to diagnose until too much damage has been done. So it's super important to get yourself tested regularly through annual checkups and physicals. And this is because kidney damage isn't noticeable until it is severe, such as, kidney failure or extreme pain and things like that. And by then, it's going to be severe because of how much pain you are in. And also, what's difficult is that many symptoms that chronic kidney disease has are very similar to other illnesses, and many people mistake it for something less serious, even if it's persistent. Some more severe symptoms one can feel or have when their kidneys are failing, so at stage 5, is vomiting, back and muscle pain, fever, diarrhea, insomnia, loss of appetite, and things like that. So it's super important when you are faced with these kind of symptoms to immediately seek medical care. So, enough about symptoms. Let's talk about treatments for chronic kidney disease. When you are diagnosed with chronic kidney disease, unfortunately, the damage done to your kidneys is permanent, so there's no cure, and the only way to really treat it is to prevent it from getting worse and to maintain whatever function you have left. So, the most basic ways of helping your kidneys and treating chronic kidney disease is by eating kidney healthy and kidney friendly diets or exercising daily. It doesn't have to be anything vigorous. Just keep your body moving and, get that everyday kind of exercise, whether it's walking around the house, going on a walk, jogging, things like that. So usually when people are diagnosed with chronic kidney disease, they already have a pre-existing condition, as I've mentioned several times. So in order to prevent further damage, I keep reiterating this, that patients must be extra careful with their routine for said disease. So people with diabetes and hypertension, they must watch their diet, make sure they're eating low sodium, low sugar, or something, tailored to them so that they are maintaining their current disease and preventing chronic kidney disease from getting even worse. And then, unfortunately, when you are in stages 4 and 5 of chronic kidney disease, you have to look at dialysis and kidney transplants, which we'll further discuss next, because those are really your only options, and things such as your diet or exercising will not help you as much as it should. And here, I just included an image of a kidney transplant and how they take out the damaged kidneys and replace it with the transplanted one. So, how does dialysis and kidney transplants work? Dialysis has 2 types of processes. One is called hemodialysis and the other is peritoneal dialysis. So hemodialysis is when your blood is being pumped out of the body into an artificial kidney called a dialyzer, as you can see in the image. So what this does is it takes out all your blood and it cleans it through the blood pump, and it pressurizes it and removes any toxins or waste found in your blood, and then puts it back into your body. This process is about 3 to 4 hours, depending on your body mass index, your height, your weight, and things like that. So, it could last from 2 to 3 hours or 3 to 4 hours, depending on all of that. And it's recommended that dialysis is done often enough so that it improves the quality of living, because, this is a function your body does usually on a daily basis. So if you do it often enough, it will replicate that. And then the second one is peritoneal dialysis. This is when a catheter is placed inside the patient's abdomen and the blood is filtered and cleaned out through their own body without the use of a machine on the side. They use a dialysis solution to remove all the waste and excess fluid, and it's a little bit more easier than the dialyzer because you don't have that big machine next to you. And the next one is kidney transplants. So what are they? Kidney transplant is when a donor donates their healthy kidney to a patient who needs a healthy kidney because both of theirs are failing or one is too weak to work by itself. So it's super important that when one is receiving a kidney transplant that the donor is matching blood, proteins, and cells so that the kidney transplant is effective and the body does not reject the donated organ. Most people who are best candidates for people who need kidney transplants are family members and people close to them, like siblings and people like that, because of genetics and DNA, they're most related, so they are most similar compared to a stranger. While kidney transplants are very effective, it's also dangerous because your body can reject the donated organ at any time and attack your organ, attack the kidney, and then cause even more pain, and then you would have to remove that kidney as well. So, how does one prevent chronic kidney disease? As I've said before, when you have a disease already, or condition such as diabetes, hypertension, or other things such as heart disease, or if you suffered from a stroke, it's important that you constantly maintain the medication you are taking for this said illness, as well as watch out for any irregularity in that said illness, as well as any irregularity in general in your body, and making sure that you attend physicals and annual checkups and things like that. Also, since chronic kidney disease may not have any visible symptoms in early stages, it's super important to regularly ask your doctor if you can get your kidneys checked and tested every once in a while, just to make sure they're properly working and functioning. If you notice that you got an UTI, for example, urinary tract infection, you can ask your doctor to check if your kidneys are properly functioning or if there's an issue or something like that, just to ensure that your kidneys are properly functioning. Other ways to prevent chronic kidney disease is by eating healthy and looking out for your diet, exercising regularly, making sure you're sleeping 8 or more hours, depending on your age and body mass index, things like that, and limiting the amount of alcohol and nicotine you intake on a daily basis. Other ways to prevent chronic kidney disease is to regularly perform an ultrasound or CT scan to get a picture of your kidneys and your urinary tract. This is recommended for people who are more likely to get chronic kidney disease or, have constant urinary tract infections and things like that. So it's super important for you to get an ultrasound or CT scan, and it's really helpful because although you may not be experiencing chronic kidney disease pain, you might have something such as kidney stones, tumor, or an issue with your urinary tract. So it's super important to get an ultrasound or CT scan to prevent any further damage to your body. One can also regularly get their blood and urine tested, checked and tested, for chronic kidney disease, and that can be done at something as simple as your annual physical or walking into your primary care doctor and asking for a test. As I've said before in the presentation, this is why annual physicals are so crucial, because something as simple as a blood or urine test can determine your health status and whether you are at risk for a certain disease. It doesn't really have to be chronic kidney disease, but it can be any other kind, because that can be most commonly found as at a start in your urine or blood test. So let's review a little bit what we learned today. And some key points that I found in my presentation were that chronic kidney disease is the gradual damage of one's kidneys, and it's split up into 5 stages, with one being the most mild, and the last one is the most severe, the 5th one. Certain pre-existing conditions such as diabetes, hypertension, and old age create a higher risk of developing chronic kidney disease, and that's why it's important for them to monitor their illnesses and be aware of chronic kidney disease. It is important and crucial to get annual physicals to check up on not only your kidney function and your damage, possible damage, but also on other parts of your body. Symptoms are usually not present until the more severe stages, yet the most common symptoms are swelling of the feet and ankles, lack of urination, and back pain. So make sure that if you are ever experiencing those kind of pains, to check it out. Chronic kidney disease is not curable, so treatments are only used to prevent further damage or to improve quality of life and maintain the disease. And prevention can be as simple as eating a healthy diet on a regular basis and exercising regularly, every day. So, what did we learn? How many adults do not know that they have chronic kidney disease? A, 8 out of 10, B, 5 out of 10, C, 9 out of 10, or D, 1 out of 10? C, 9 out of 10. 2, what are symptoms of kidney failure? A, vomiting, fever, back pain, sore throat, runny nose? Or C, eye irritation, blurred vision? A, vomiting, fever, and back pain. It's a tricky question because you never know. The symptoms are so common and universal that sometimes you don't know what you're experiencing. 3, what does dialysis do for a patient? A, filters out bacteria in the stomach. B, helps the patient urinate. Or C, filters out toxins in the kidneys. C, filters out toxins in the kidneys. And 4, what pre-existing condition cause a higher risk of CKD? A, diabetes. B, high blood pressure. C, substance abuse. Or D, all of the above? D, all of the above. So Thank you so much for watching my presentation, and I hope you enjoyed and learned a bunch of new stuff that you may have not known before. Here's just a couple of my reference lists, and I hope you enjoyed. Thank you. Have a great one.